I'm going to spend a couple of minutes now just talking to you about what hypnotherapy involves. For some of you listening, you've already had hypnotherapy and experienced what it's like. For others, there may be a slight question mark about what it involves and what's the difference between that and stage hypnosis. Well, of course, both stage hypnosis and hypnotherapy both use trance. But the difference is stage hypnosis is just for entertainment, whereas hypnotherapy is the combination of trance with a therapeutic technique or a particular intervention such as cognitive behavioral therapy or hypnoanalysis or maybe solution focused therapy. There are many different therapy techniques that are used by hypnotherapists. It's important to realise that most of the time we are not really aware of just how in control our unconscious mind is. Some people have referred to the unconscious mind as like a reel-to-reel tape that's playing in our minds, and it's actually dictating a lot of our thoughts and feelings and behaviours. Because we can't access it, and because it's been playing for years and years, since childhood, early development, all the experiences we've had in our lives, we don't acknowledge it, or we don't really understand that it's in control. And so the question is, how do we access that? Well, of course, most of the time we're engaged in the normal day-to-day activities that take us away from concentrating on our inner world and very much just focusing on surviving, getting through the day. But when we are in a state of hypnosis and hypnotic trance, we can then start to investigate the inner mind. So how do we get there? Well, a hypnotherapist has been trained to use certain techniques in order to relax you so that you are in a way much more open to suggestion, much more relaxed and concentrating on the words and the language that the hypnotherapist is using. So all hypnotherapy sessions will start with some form of systematic relaxation. And when you are in that state of relaxation, you can then go on and start to work on whatever the issue is, whether it's smoking cessation, diet, anxiety, trauma, all the range of different conditions and problems that people come to seek help from a hypnotherapist for. And so this state of trance, you're systematically relaxed, and what it does is it enables you to have a narrowing of concentration and a heightening of awareness in much the same way as, for instance, you're driving along a motorway. Time seems to go very quickly when you're driving, and often we arrive at our destination and time has kind of gone very fast, and we think, how did we get there? Well, that's because we're actually in a state of trance. We've got narrowing awareness, heightening concentration. And it's important to understand also that when you're in a hypnotic trance, you're experiencing things very differently. In actual fact, you are paying attention to a lot less, but the things that you are paying attention to, i.e. the work that you're doing with the hypnotherapist, you're giving it much more maximum attention because you're in that state of relaxation and your awareness has been heightened, the concentration has been narrowed. So it's relaxing and attending to whatever it is that the hypnotherapist is working with you on. And what this is all about is that most of the time we have the conscious mind at the front, which is attending to everything around us, our immediate environment, whereas the unconscious mind is further back. And if you're not really relaxed, then if you go and see a hypnotherapist or any kind of counsellor or psychotherapist, the conscious mind will be thinking a lot more, and often that boils down to putting up defences or not feeling comfortable working because you're not sufficiently relaxed. But trance enables you to get into that state of relaxation where you can start to work on the things that you want to change or investigate, look at, and move on with. And so your conscious mind is in effect just taking a bit of a break, and your unconscious mind is coming to the fore. Now, one thing that often people ask is, if you look at films about hypnotherapy, or not hypnotherapy as such, but hypnosis, because that's what films seem to centre on, there's always this idea that someone has been zonked out and the hypnotist is in control. Well, actually, that's not how it works, because you have to want to be hypnotized in order to be hypnotized. You have to want to go into a trance in order to experience one. And so it means that the driver is you, and you're the one who has given permission, and it's something that you want to do. And actually, if you are in a trance and something that you don't like, or perhaps you're not ready to deal with something that's come up, you'll sometimes find that you'll just come out of trance spontaneously. And that's because you are still very much aware of your external world. You're aware of what's happening, what's around you, the words that are being said. You maintain consciousness throughout. It's not the case that you are put to sleep. They used to call hypnosis somnambulism. In other words, that you're in some kind of like sleeping state. That's not hypnosis. You're still very much aware, and actually you're just in different brain waves than you would normally be, because the actual trance, the act of going into a trance and being systematically relaxed, means that you're operating using different brain waves for the duration of the trance. And so you are still aware, you're in control. The last thing to say is that some people, they go to see a hypnotherapist and maybe 1 or 2 sessions max. For other people, it's an ongoing thing. And it's important to just bear in mind that the more time that you're working with a hypnotherapist, or any kind of therapist for this matter, the more that person is getting used to the way that you see the world, your personal story, the way that you explain reality, the choice of words that you use, and the way that you express yourself. And so what we're talking about here, as with all therapies, it's an alliance between you and the therapist. It's called a therapeutic alliance. And the thing about hypnotherapy, because it does operate using language, you are learning the language. The hypnotherapist is learning your language and learning how to put things in a way that will be receptive, that you'll be receptive to, and which will be pleasing or be helpful for you. And so it's very much a cooperation between the two people. So I hope this video has explained a few points about hypnotherapy. Obviously there's lots and lots more. The history of hypnotherapy is really, really interesting, all down through the ages, and especially in the 20th century, when it became more mainstream and was used as a substitute for in one case, during the First World War, it was used as a substitute for analgesia, because people couldn't get hold of it, so they started to use hypnosis in order to perform minor and some major operations. But in any case, that's something for another video. But it's a fantastic and fascinating subject, and it's a wonderful therapy which is kind of non-invasive, and it's very easily enjoyed by people. Actually, most people say that they really enjoy the relaxation, the physical and the mental relaxation that accompanies going into a trance. So thank you for listening.